Welcome to Survivor Rites, everyone. Another week has passed. We are live tonight, where our show is called Therapy 101. I just want to remind everyone that we are not here to tell people how to live, what to do. We are literally here to share information and give you the tools and resources that you can take what's for you and leave what's not. Tonight, Unbroken Therapy 101 with Dr. Natalie Bolin and Dr. KP. I'm going to go off video and let them just hop right in because they are the pros here tonight. So if any of you are interested in their credentials, which I hope you are, I did post those earlier in the event notes. So please feel free to take a look at those. So with that, Natalie, I am going to turn the floor over to you.
Sounds great. All right. Well, welcome everyone. We're really excited that everyone's joining us tonight. We're going to talk Mental Health 101. So, we're going to go over exactly what Pathways to Healing is, our process of when survivors reach out to want to access mental health treatment. And we'll go into some details to answer some of the questions that are out there. And we'll talk briefly about some different types of therapeutic techniques. And then I'm going to invite Dr. KP to share from a provider's perspective what it's like to work within our community. And I know she has a survivor healing story that is just super impactful. So with that, Pathways to Healing, we have a website, pathways, the number 2 healing.org. We are a 501c, and we put together Pathways really to focus on survivors from the 2x2 church, survivors of child sexual abuse, spiritual abuse, betrayal trauma. And we wanted to support our survivors, connecting them to trusted therapists, trained advocates, and really help build a compassionate community so that they can navigate their healing journey. Under Pathways, we have 5 different teams. So, our first team being our communications team. And this team does a lot of our social media posting. They help manage messages that come through in all different socials, very important. We have our care package team that we have North America, South America, and South Africa, in the UK also. And these care package teams will send these amazing care packages to survivors. And they're very well thought out and just loving. A lot of them have a um, home art and quilts, and there's just a lot of thought and care that go into the care packages. We have our wellness series, and it's where we highlight different types of healing practices, and we'll bring on different professionals to talk through different topics. I think our next one, our last one, was a trauma nutritionalist that came on. And then, of course, we have our advocate program, which we do our advocacy training. And then we have our trained advocates to provide support to our survivor. And then lastly, we have our clinical team. This is a team of 4 therapists. One therapist is international, and we are the ones behind connecting our survivors to different therapists like Dr. KP, and that's done worldwide. And so the way that you can connect with us, there is a Connect Us on our website that goes to a secure email that's just managed by the clinicians. And people can also reach us through our WhatsApp. There's the telephone numbers on our website. And I just want to emphasize that all communication is confidential, even reaching out to us. We will never identify those who have or haven't. We work under professional license, and so we take confidentiality very, very seriously. Information that we gather and I'll go into what types of information that we gather. We have an electronic health record system called Jane. And so we are HIPAA compliant and we keep all of our information stored in our electronic health record system. So after reaching out to Pathways, the process of finding a therapist, we'll ask just some very simple questions about whether you want to see somebody in person or online, whether or not you have a gender preference. We'll ask just very concisely the reason for treatment, and this is to help match the credentials of therapist. So if someone says, I'm just really depressed or I'm just really anxious, or they don't have to go into a ton of details. We're just trying to match with the credentials. And then we'll ask about zip code because that's how we search for therapist. And then whether or not you have insurance and whether or not you want to use insurance or apply for the private funding. And we'll kind of talk through that as well. So when we look for a therapist, we can filter by issue, by license type, area, experience level, different therapeutic approaches. Sometimes people will reach out to us and they already have a therapist and they're just requesting for financial support. And that's perfectly fine as well. And so we'll ask the survivor to fill out an intake form and a release of information. So that way we can talk with the therapist and the therapist can talk to us. We ask for a treatment plan every 6 months. And the reason for that is it gives us the length of time for treatment so that we can budget out for the different private funders that we work with so that they know they have the funds to pay for treatment. The last thing we want to do is start somebody in a trauma treatment and then 2 months into the work come back and tell them, oh, we ran out of funding. We can no longer fund your therapy. We fund 6 months at a time. And so sometimes there's a waiting list for private funding because of that, because we've budgeted out and the funds come back and say, yep, we're good for this amount of time, or no, we need to wait until somebody transitions off of treatment and then we can accept another survivor. All of our communication with the different funds are done in a confidential way. So Pathways to Healing will give a unique identifier number for each survivor, and it's that number that we use to communicate with the funds. We do not use name. And again, all of this information is stored in an electronic health record system. So our different funds that we work with, Bridges and Balm, they are non-ministry funded. So all of the funds are by private donations. We work with Renewal North, and they are non-ministry funded as well. And then we also work very closely with United Open Arms, and they are ministry funded. So sometimes that matters to survivors. And so we're very open about the different funds that are out there, and we will talk to survivors about that. So when somebody access mental health treatment, that initial appointment is an assessment or an intake, and that can last. It can last 2 to 3 different sessions. We let survivors know that you don't have to tell your whole story in the first session. We actually we don't want that to happen. Clinically, that can impede somebody for wanting to come back if they overshare in that first session, to not want to come back for a second session because they feel like they've shared too much. And a therapist will know to not allow that to happen as well. And so when you do start working with a therapist, it's really important for it to be a good fit. And that might take a couple sessions for you to determine whether or not this therapist will be a good fit for you. It's okay for it to not be a good fit, just come back to us at Pathways and let us know that, and we'll connect you with a different therapist. And so, some of the questions that you can ask the therapist, just what does treatment usually look like? What different therapeutic approaches do you use? How do you usually measure success? When do we check in about if you think I'm progressing or not? How often do you see clients? How long are the sessions? Those are just some of the questions that you can ask a new therapist. What happens if I don't feel like therapy is helping? How do I approach that conversation? And so, some of the things that you might feel coming out of a session, if you felt heard, um, I would always what I did clinical supervision for years and would teach, my interns the 80/20 rule, where therapists should, be listening 80% of the time and talking 20% of the time, just on average. I mean, there's going to be times where sessions vary. But you feel like your questions are being answered and you feel comfortable. Um, a lot of the indicators for treatment is that relationship between yourself and the therapist. So we just want to make sure that it's a good fit. And so there are different types of trauma treatment. um, we'll kind of go, I'm going to turn it over to Dr. KP to talk about what it's like to work in our community. And I'm sure different types of treatment may or may not come up, but we can come back and kind of talk through what are some different types of trauma treatment you can ask for or inquire about. There isn't one treatment for every client. It can vary depending on the symptomology and just the response that a client might have to treatment. So, with that, I'm going to turn it over to Dr. KP.
Thank you so much. Thank you so much for having me. So, as you explained, when a survivor is referred or they're assigned to me as a therapist, we'll do an intake. That may take, as you mentioned, 2 to 3 sessions to really get to know them, their story, and most importantly, to develop that relationship that, in my opinion, as an attachment-based therapist, is the most important part of treatment, that therapeutic relationship. I am training different modalities of trauma work. I mostly do EMDR, the eye movement desensitization and reprocessing. A lot of people tend to like that because it's less narrative and more experiential. Your brain kind of tells you what it needs to tell you for healing process. And depending on whether I'm doing it online or in person, I may use different ways for what we call bilateral stimulation. So there's a lot of research behind it. It's a very efficient way to treat trauma. But again, it's not for everyone. Some people call me and they really want to have EMDR. And once we try, they're like, it's just really not for me. Some people are very skeptical about it and they're not really looking for it. We try it and they're like, this is the best thing that has ever happened to me. So, as you mentioned, it's important for me as a therapist to be very client focused and patient kind of centered and kind of adapt the different modalities to different people. I do also use internal family systems theory that kind of argues that we have internal parts within us that respond to pain and past trauma. And we do have in exiles, which is our wounded parts that we can go back and try to heal, particularly in a survivor perspective, because there are so many attachment wounds that happen within survivors in this population. So that's the one that I mostly use. I use EMDR, attachment base, and IFS. I also train in trauma focused CBT. So they are, again, different modalities, and we can have like a show about each of them, but they are just kind of an overall understanding of how to kind of go about it depending on the style of the personality type that the survivor has. and really their level of kind of comfort with each of them.
That's great. Yeah. Yeah, and like you said, not every survivor will respond one way or another, and sometimes you don't know until you try it, and then they will
They
tell
love
you.
it. That's
Yeah,
right.
yeah. And I think I also trained in EMDR too, and, I think for me, most clients were a little bit skeptical because it's
Yeah.
just different, right? The bilateral stimulation, or you use paddles or lights, and so they're like, "What is this? Is this hypnosis? What are you doing?" And so, yeah, working through that. What are some of the working with survivors from the 2x2 community? What are just some cultural things that you noted working with survivors from this community?
Yeah, so I've started seeing a pattern with most kind of cult like cultures of kind of following the cycle of violence that we will see in personal violence, the same idea that they are in a power and control dynamic, and it's hard to kind of escape that cycle. And the idea is that I also adapt culturally to them. So my particular survivor, she's actually very excited for me to kind of share her story. She's in what we call post-traumatic growth, which is process my trauma. I'm healed from most of my trauma, and I want to share my story and connect to my community in a different way, the survivor community in a different way. She was actually born and raised in Mexico, so having to see that there are patterns that are very much cultural within the culture of the 2x2, but also different cultures around the world. So it was very important for me as a bilingual and bicultural therapist to kind of be aligned as well with that, and making sure that there are things that actually are cultural from Latin America perspective that very much match um, this culture. So it was kind of almost double down, particularly from like the male perspective, and males being the head of the culture, in women having more of a kind of back seat and not having a lot of control of their families and their lives. So there are so many different patterns that you can find regarding of culture, age. The survivors that I had were all born. I know not everybody is born into the 2x2, but the ones that I've have served were born into it and not feeling like they don't have a choice, that this is just a way of being, was one of the most difficult things to overcome.
Yeah.
There is one perspective within the survivor that she wanted to make sure that I shared, that during treatment, she actually was diagnosed with autism spectrum disorder, which is a very particular type of neurodiversity. And she wanted to make sure that I share how difficult it is to overcome in general. But if you are autistic and you have already very rigid boundaries and you tend to follow rules, these rules that were imposed to her from the moment that she was born have been very, very difficult to overcome. And yet, because of her ASD and her high intellect, is the reason she started questioning right about after she turned 29, 30, and she saw a lot of violence in her country and she came to the States. So it put her in a very difficult position, but also gave her the ability to intellectualize a lot of things that were happening and kind of question, maybe there is another way and maybe this is not healthy. They come from a big family of 8 siblings, and she's the only one in her family who was able to kind of overcome and have therapy and really start her healing journey. So she's an inspiration for all of them.
Yeah. It's
Hmm.
amazing.
It is.
One of the themes that we see too is our survivors coming in not feeling worthy for treatment, and I'm wondering if that has been your experience as well.
Yes, the sense of lack of worthlessness and the inability to see their own sense of worth is very common in most abusive relationships, which is again how I see um, survivors, particularly from this group. In IFS or attachment-based models really speak to that. Going back, so when I'm following attachment-based models, and after I do the intake, we develop a relationship, I tend to follow a timeline, APA guidelines for trauma. Evidence base argues that when you have a timeline, you can go developmentally and go back and try to heal that inner child from the earlier memories that they have. And so the idea is that they're going to go back and heal that part of them that is wounded for whatever reason. Things that are very specific to her included not having a lot of personal space when workers will come to their house and will stay sometimes weeks at a time. They wouldn't give them a lot of privacy, or dad will feed them better than even their own family because they lived in a lot of poverty and they couldn't really afford having them in the house, but yet that was an expectation, and to feed them the best food that they could. So there's a lot of things that happened for her within her cultural background and her ASD diagnosis that she feels that putting everything in the little puzzle pieces together has brought her the most healing.
I know you mentioned, so after that initial intake and assessment, working towards a treatment plan, which includes the modality that you're going to use. Will you talk through a little bit about what is included in a treatment plan and what it's used for clinically? I kind of explained what it's used for on the funding part of it, but it's different clinically.
Absolutely. It is. So I know different therapists have different styles and modalities, but I tend to be very goal oriented and focused. Sometimes, if you bring complex trauma and you have so many trauma stories, you can get lost in just kind of sometimes venting or chatting when you don't have a whole of healing. So, a treatment plan will include goals and objectives of how to get there. Um, and I just want to say out loud how amazing this organization is. I serve 5 different nonprofits from around the world that serve different populations. And what's challenging about the nonprofit world with trauma survivors is that it's very limited. Some organizations will say, we're trying to help this survivor, but we have 10 to 12 sessions. And it's very short term, and there's not much that you can do for trauma during that. So I have to educate them. A lot of nonprofits leaders are not clinicians. So I have to go through the process of saying, I can see them, I can be brief oriented, but it's not likely that you're going to bring a lot of healing with complex trauma anywhere from 10 to 12 sessions. So I just want to point out the fact that she's been able to connect, and she's so grateful to have an organization that will support long-term healing. That it may take, everyone is different, but it may take long-term, especially if you were born into something like this, and then you add physical abuse, emotional abuse, not only from the organization and the group, but also from family members and all the things and the complexities that come with that. So a treatment plan is very important because it keeps us focused. It keeps us, are we making progress? Sometimes we have to change the modalities if they feel that it's too intense or not intense enough. And it's important to revisit it every 6 months. My health record actually sends me a notification every 90 days if I put it there, to just make sure that we're all aligned. And treatment plans are also signed by clients to make sure that we're all on the same page and we know. It's kind of like a map. Where are we going? Are we
Great
agreeing that we're
analogy.
going to the same place? And how are we getting there? And just constantly revisiting. So obviously, most people that come from a group like this will have trauma healing as their main treatment goal, and going about it in a very concise, trauma oriented timeline helps us focus. So every time that I see, we'll have 10, 15 minutes of maybe, is there anything that we need to process from within the week or two? And then we go back to the trauma timeline and continue their trauma journey. Without that structure, what I found, especially I've been in this field for about 25 years, is that a lot of people get comfortable with a safe space and they just go into processing their everyday life.
Yeah.
But then it's hard to get into the healing process, because my job is not to have a job, is to
Right.
make sure that you have as much healing as possible. And that is a fine dance. I also don't want to appear like I have my own agenda and say, well, too much processing, because what does that even mean? But it's important to have that relationship of constant back and forward into what are the priorities in that
Such a
moment.
fine balance.
It is. It
So
is
hard
difficult.
sometimes.
Yeah, but that's what
Yeah.
the relationship is for, is there feel
Yes.
open. Sometimes I'll have survivors. I would say, today is a rough day. I'm very dysregulated. Can we please just talk about what's going on in my life? That is all related with their trauma. And that's
Yeah.
very important, to just be in that space. Other times they're like, I had a great week. I have not much to process. Let's go into our trauma journey and continue the healing process.
So it's kind of that 3 steps forward. Sometimes there's 2 steps back, but you're
Yes.
still making progress, but it is not a linear process at
It
all.
is very much not a linear process. And what's interesting when you're doing attachment-based trauma-focused therapy is that you see them going through different developmental stages. And there are times in which they decide, for example, not to be in the same relationship or move to a different state or change careers. The survivor that I'm discussing today, they were born and raised in Mexico, and they are a professional engineer, systems engineer, and they're having a very hard time with the transition of not working in their field and with everything that is going on just right now in this kind of social political environment. So they're also very grateful for the organization that, regardless of what country you come from or where you are, that you see the sense of humanity and survivors in all of them, and they're able to receive treatment as well. That's
Yeah.
very unique to the organization and is very amazing. And I, as a Latina immigrant myself, I'm so proud to be part of that, because right now there's a lot of people suffering and with not a lot of resources.
Yes. Agreed.
Hmm.
Do you want to kind of talk through your survivor's healing process and her healing story?
Yes. So we met. This survivor has been in treatment for, I think, a little over a year now. We just crossed the year mark. They were encouraged to seek treatment by another survivor. Unfortunately, therapy in the Latin American society is still much of a stigma. There's still a lot of unknowns and a lot of assumptions about the process. So it's not very common that people will just reach out for therapeutic help,
Sure.
even if they're suffering. And after they reach out, they asked if I could serve them. We connected with the organization, and we've been in the process ever since. They have a very particular, interesting story, because they were born in a lot of poverty, and they're a very big family. As I mentioned, there's 8 of them, but they're the only one that have been able to kind of leave this group. And mostly they did that because they have a daughter now. And that's why they left their country as well, because of the violence that was going on. So, as you can see, there are so many layers of trauma with individual, family, religious, cultural, societal. And they have been, another part of being in the spectrum is that they've been very focused. I'm so proud of them, because this person is very committed to their treatment. I don't think they've canceled like late cancel or Nashville. This is someone that is so committed to their process. And as I say, sometimes they may be having a hard time and be dysregulated, and other times they're just very focused on their timeline and their trauma work. The other component that they wanted me to make sure to mention was the physical effects that this complex trauma can have on them. They had so many physical really symptoms as a result of her complex trauma, and the importance of kind of pointing that out. While we were in treatment, they were able to get a better health. As we know, I think you mentioned it before, that The Body Does Keep Score is a great book that really shows the science behind what happens when you hold on trauma so much. And this idea that this is the only way, that I'm not enough, and the more that I suffer, the somehow the better that I'm doing. And it's a completely different mindset and dynamic when you're trying to serve them and you're trying to help them see a different perspective of the world. So they have been an inspiration not only to other people in the survivor world, but to their family. There are family members that are seeing them change, and they're asking questions because they're related to them in a very different way. And they mentioned how important this is for her to break generational trauma, as her daughter, who's now 8, has not been a part of this, doesn't have any memory of it. And they're very proud to have more secure attachment within them so they can pass that on to
Yeah.
their daughter. So they're
Yeah.
very, very inspiring. And because they're in the post-traumatic growth phase, they wanted to share their story. I think they send some things in writing, some images, and they're very much aware and listening today into how their journey can impact other people and hopefully inspire them to seek help.
Yeah. Yeah, and you mentioned, the time frame. Sometimes we'll get survivors that want to double up on their healing, and so they'll try to get multiple therapists in place, and they think they can fast track their healing. And I wonder if you can maybe speak to that because that's something that we keep an eye on under pathways, understanding that that can cause a lot of harm when survivors want to quickly heal and kind of liken it to losing weight. It feels like you put on the weight really quick, and so you can lose it really quick. And sometimes it takes twice as long to lose the weight. And so, kind of similarly to healing trauma, the time frame, I think you mentioned you've been working with the survivor for a year. And for survivors that are listening tonight, um, maybe talk about the healing process and maybe what happens if a survivor feels stuck in therapy.
Mhm. Yes, the healing process is so individualized to every
Yeah.
person and every survivor. From my experience working, I'm also a veteran. I'm not sure if I mentioned that this in my bio, but as a veteran working with people with PTSD constantly, what I've learned and I've seen the pattern years after years is that the first part of therapy, usually when we start with early childhood memories, is the most difficult and dysregulating one. Because if you think about it, there's a little person within you that has this heavy memories that were not meant to even be a part of their existence. They were not supposed to be holding space for this type of memories, whether it was sexual, physical abuse. From my experience, usually the first um, years in the timeline, depending on how much trauma you have in your early childhood, can be not only the most difficult, but the ones that take most time. Sometimes, as you mentioned, we take 3 steps forward and they're feeling better, and then the next memory comes and is so dysregulated to them that we just have to be there and stay there and really attune to your body and what it's telling you. After the first memories and after you pass early and later childhood and adolescent years, then it gets a little bit more manageable. Maybe not easier, but maybe a little bit more manageable. And then people start making progress in a more steady way. My survivor that I'm speaking about today, she's physically 33 years old. She's 22 in her timeline. So she may be able to do maybe a couple of memories a session. When we first started, we had to have a couple of sessions per memory. And being patient and understanding with the process, yet goal oriented, it's something that I take a lot of pride on trying to kind of guide clients into it. There are sometimes once they are in adulthood or late adolescence in which maybe they can do some intensives if they want to have a couple hours per session and kind of speed the process a little bit. That may be clinically appropriate, but again, it all depends on your story, on your self-regulation, and how much you can contain while going through these experiences. But early is gonna take some time, either weekly or bi-weekly. However, you can have your schedule sessions, and it's so worth it and so
Yeah.
empowering. And as a trauma survivor myself, going through the healing process has been the most rewarding and empowering experience. Once you have secure attachment and you feel like all those negative cognitions and beliefs that you learn in your trauma journey don't have to kind of keep you down and hold you from being truly who you were meant to be.
Yeah. It's amazing. And as a
Yes.
therapist, I mean, this is what keeps us going, right? Is
I
to
know.
to
It's
be
so
part of that healing
exciting.
process. It is so exciting.
Yes.
Will you talk a little bit about the connection between trauma and negative cognitions?
Yes.
That's a huge aha, I think, for a lot of our survivors, because a lot of our survivors coming out of the church have a ton of negative cognitions. And I mean, that was really even emphasized in the church, dying to self. Your salvation is wrapped into really not being your authentic self. And
Right.
so much to work through in that space. So I wonder if you could speak a little to that.
Yes, absolutely. So I think what we know in trauma and through the research is that trauma is not so much actually what happened to you, but how you internalized it. Examples of negative cognitions may be I'm bad, I'm unlovable, I'm a horrible person, I should have done something, I'm alone, I'm worthless. I'm helpless, I'm powerless. All these negative cognitions that a lot of people are not really aware of. They know they went through pain, they know they experienced, they can remember it. Some people disassociate it and actually they can't remember until we go through the process, but they don't realize how their body has internalized these memories, which is what we know. It's the most important part to heal through the trauma process. I think this is the biggest misconception of trauma work. Most people are like, but that's in the past. The coaching perspective that is a lot in self books or a lot of podcasts that I've heard, and I'm like, oh, we need to have better conversations like we're having right now. That it's in the past. You just move on, be positive, use positive affirmations, don't get stuck in your past. And that's obviously at a easier said than done. What we know with trauma is that that's not physically possible. We don't just move on. We don't just forget. We always remember, and your body knows. What's important through the healing process is that I usually give this analogy of having open wounds. So just our physical body, just like our emotional body. If you have trauma, you have open wounds, you're constantly bleeding and you're sore, and maybe someone puts alcohol in it by mentioning something. Maybe you see a movie, maybe you hear someone, and you have what we call flashbacks or this kind of vivid idea of what you're going through. Going through the trauma journey, what we do is we heal those wounds. We kind of go in there, try to do anything that we can to heal it, kind of stitch it up and allow it to heal. And you will have scars. Trauma doesn't just disappear and go away. But as you have any physical scars, if you put alcohol on it, it won't burn anymore because it's healed properly. And I think that's what a lot of people don't realize. Why am I going to talk about the past? It was hard enough. Don't talk to me about it. And their idea is whether you talk about it or not, it's affecting you. It's affecting your life, your family, everything you do. And through the trauma journey, then now we know that these negative cognitions can be healed. And you can go from feeling I'm bad to I'm perfect just the way it was and it wasn't my fault to I'm alone, from I'm alone to I'm connected, particularly within my body and my system was we develop what we refer to as core self, the securely attached adult persona that you can have from within and also through your community. The other component that I add in my trauma practice as a collectivist is the importance of connections within the community, within your family, this idea that we're alone and we are wired for connection, as we know in the research, and being able to connect and go back to it is very, very important part of the trauma journey. And that's exactly what the survivor is doing tonight, connecting, I know through me, and I'm trying to do justice. If you're listening, Elizabeth, I'm really trying.
She's doing amazing.
Thank you. Oh, Elizabeth. And so it's just really inspiring.
Yeah, it is. And part of doing trauma work is working around repressed memories, which you mentioned. And I think sometimes that's why the average age of reporting your abuse is 52, is the average age, which breaks my heart.
I know, it's
And in
such a
this
long time.
crisis, we are working with victims from age 8 to 91.
That's
We
right.
have in the 90s, they're just
Oh,
reporting.
wow.
And so
Mm.
maybe talk a little bit about repressed memories, and just kind of putting it in context, like, we might have someone in their 50s, 60s that all of a sudden are starting to have memories surface. And why would that be?
Yeah, that's such an important question. What we know is that our brain is actually pretty cool. It knows what we can handle and what we cannot.
Yes.
So if we have memories that within our body or our current situation are too heavy, our brain knows to kind of put them away and only give them to us when we can handle them and when we're ready, when we're connected through the maybe someone else's trauma journey, through vulnerability. So from my perspective, experience, and based on research, having these memories come up is actually a good sign of your system feeling more secure and attached and saying, maybe now you can handle it, we can heal it. And before it was just too much. Repressed memories actually come a lot when we're doing trauma work, particularly EMDR. With the EMDR, sometimes these memories, people will leave the session and they will continue to process. And I always tell them, if there are more memories that come, make sure that you log them, make sure that you do in any type of way, remember them so the next time we can add them to your timeline and address them. So yeah, this association suppressed memories is a very big sign of complex trauma. And it's just our brain saving us from what it could happen if we remember them. And for some
Yeah.
people, it may be not being here, feeling suicidal, feeling homicidal,
Yes.
um, getting deeper into substance use because it's just all too much,
Too
too
much.
dysregulated. Hmm.
Yeah. Yeah, that's such a great explanation. We we see we also see a lot of survivors because there is a huge FBI investigation
I
in the
know.
church.
I know.
And so survivors coming forward will often attach their healing process to the investigation and whether or not their criminal investigation is progressing. And I'm wondering if you can kind of speak to that a little bit. I brought it up in previous videos around trying to separate those two things, but it's really hard
It is really
for our
hard.
survivors. So maybe would you mind speaking to that a little bit?
Yes. Again, such a difficult since it's not within their control, having that sense of attachment to the investigation. From my clinical perspective, and I usually use personality theory, there are some different personality types that have a higher sense of justice. When you have a high sense of justice, you really want the person who do you harm to pay for it in whatever way they can. And that's usually the people that will have a more attachment to that sense of justice through their treatment. Oftentimes, if it's brought up in the clinical setting, I empathize deeply with that and
Yeah.
noticing and acknowledging why you will feel so attached to that because it feels like it doesn't matter what I do if they don't pay for this, or if there's not a good outcome of the investigation, then um, is it even worth it? And so
Yeah.
helping them separate their internal healing, regardless of the outcome of this investigation, is a very big, important part of the clinical process, but also very difficult. So sometimes we just stay there with acknowledging how difficult it is to have no control over the outcome. And sometimes acknowledging the fact that there is an investigation and that finally someone and
Yeah.
something is happening. So usually when you empathize with them in that space and create the big acknowledgement as of why that's important to them, and use secure attachment language through that, then they're able to acknowledge it and understand and continue in their path without letting go of it. I think the other important component of it is that if you go um, to the extent to say, just forget about that, don't even read about it, that doesn't matter, you have no control of it. That also wouldn't be clinically appropriate as part of their journey is to be informed and to do whatever it takes and whatever is in their power to continue to seek justice for them and the continuous victims that this group has. And that, again, not only here, but around the world. So it's again, it's a balance between acknowledging, taking action if you can, kind of like what I'm doing right now. My client has a very big sense of justice and sharing her story and having more people coming forward with their stories, with their healing, and helping the investigation is a big part of her trauma journey and her healing. And I'm again doing it as much the best that I can through them, but everybody will have a different perspective on it.
Yeah. I mean, it's so validating for our survivors to hear that wait a minute, I wasn't the only one that went through this experience,
Correct.
and there's other survivors out there. So that's, the community that we're trying to foster, and building that supportive community is just really important. One of the huge things we're trying to kind of lift up is around forgiveness, because there's a lot of pressure from the church and from the church community to forgive and move on.
Hmm.
And I'm wondering if that has come up in some of your sessions, or if you've kind of experienced that as a provider, what to do with forgiveness, especially around spiritual trauma and the importance of that.
That's right. Oh, we can have a whole other show on forgiveness, right? Or maybe you already have it and I just have to watch
No,
it.
no, we probably should.
Maybe that's the next one. Oh my gosh.
Yeah.
Clinically, the way that I usually present forgiveness is with the analogy of the hook. I learned that in grad school through an internship, and that was so impactful to me. And the argument is that once we hold that sense of anger and resentment, it's really hurting us and not the other person. And also just revisiting the definition of forgiveness, that it doesn't have to be having a relationship with these people or
Right.
letting go of your need for justice. It really just means the release of your own anger and resentment through the process of healing. That way, you don't have to be the one dealing with the pain that comes. But some people argue. I remember I just saw a clinician in a national conference saying, "No, I don't forgive him, and that's okay. I just don't hold anger and resentment." So I think there's a lot of ideas around forgiveness, whether we have to or not. But I know it's very much based on the faith that you have to forgive and move on.
Yes.
And the reality is that we have to just engage with what that means. Do you have to? Not necessarily. What does that mean to you? So I usually go in a very individualized way based on the client into what forgiveness means to them. And usually after I present it in the fact that it's not letting go and just forgetting about it, they're okay with it. And maybe we use other words such as healing instead of forgiveness, because it has a
Oh,
very
wonderful.
important and negative connotation that if I forget, I'll forget. And we don't forget. And we continue to fight for justice and to get the healing. So sometimes it's just using different phrases, not by just ignoring them, but by reframing them and kind of reclaiming what vocabulary you want to use. It's
Mhm.
okay to say, I'm not going to forgive. And
Yeah.
clinically, that will be appropriate as long as we're not holding on to that anger and resentment. Mm.
Such a great explanation. A lot of another topic that comes up a lot for us is boundaries. And
Oh,
because of this community being so connected, and it's actually a very small network,
yes.
that is, we can have family internationally. And it used to be that you could travel internationally and find a meeting associated with
Hmm.
the church, and you go. And so there's all of these different, everyone knows everyone basically.
That's right.
It's a very small, close knit community. So maybe talk a little bit about boundaries and the boundary work that you can do in therapy.
Yes, again, another big topic. We can talk
I
for
know.
another show, right? But boundaries, I think, have been one of the most difficult things to overcome with this population, as boundaries are not perceived to be healthy within in the group. It's I'm kind of giving up who I am, my body, my space, my sense of worth for to be part of this community, and that's actually what's expected and what is perceived kind of higher in the level of expectations and kind of wisdom that comes with the less boundaries you have, particularly with people in leadership, kind of the more holy you are perceived. And then trying to reframe what boundaries are. I think Brené Brown, and I don't want to misquote it, but she has a really good definition of boundaries that is just kind of the line that I have to have where I can love me and love you at the same time.
Yeah.
And this sense of self-love it's been very difficult to find with survivors. There is no sense of the self is kind of lost in the group. and it's
Yes.
expected to be lost. Correct.
Yes.
So finding the self and the connected self into what is it that I want? What would I like to wear? Things like I want to wear earrings, and that's now a big decision.
Right.
Dress maybe a little bit more feminine, wear my hair how will I want to. So boundaries is a big thing to kind of use in therapy, reframe in therapy. And I love that definition, the space in which I can love myself and be
Yeah.
okay with who I am while also respecting your boundaries. So during this therapeutic process, a lot of relationships do change if they go into relationships that were expected to be um, that don't have boundaries where you don't lose your body. I mean, talking about things, intimacy, sexuality, having a voice into what you want or don't want to do. The food that you do want to eat has been so challenging, but again, so empowering once you go through the process.
Yeah.
And again, different decisions are being made now that they're adults and maybe the relationship that they're in. If their partner is not growing with them, unfortunately,
Right.
they may not continue,
Yeah.
and that's important. I usually brief that during the intake process, how when we start healing, our perception of the world may change, and maybe our circle may change, our relationship with people may change, and that's okay and healthy. But they are the ones who have to decide who to keep around, who to have better boundaries with. And it's a very natural. I think a lot of people have this misconception that the therapist is gonna tell you what to do, who to be married with, who, and we don't do that. It's beautiful to see them grow and make their own informed, healthy decisions that
That's right.
we will never impose, and that's part of their therapeutic journey to have those
Yeah.
boundaries. Mm.
And I think that's a lot. There's a lot of myths out there about therapy. And, the ministry used to tell people don't go to therapy because they're going to, they're going to influence you to make decisions that are not spiritual or, guided by God or whatnot. And that just doesn't happen in the therapeutic process.
It does not. I actually had someone who is not part of this group, but is very faith-based, and faith is very important to them, saying therapy was the most spiritual thing that they have done and actually brought them closer to their faith. So it's really a representation of who you are and what you want. And with this particular group, however, because there's so much betrayal and so much pain going on, having that sense of understanding from the beginning that you can make informed decisions. And that's what it was healthy from the
Yeah,
beginning is a very challenging phase, but a very important phase of
it
adulthood.
is.
Mm.
Yeah. So important. Well, and because of the concurrent FBI investigation and then so many survivors coming forward, I think there's also talking about reporting and informed consent and there are limitations to our confidentiality as therapists. Do you want to just briefly speak to that about what our limitations are as therapists to reporting and to breaking confidentiality?
Yes, so this was actually a change for me as I'm a veteran. I worked in the federal government, serving active duty members and their families for a long time. It used to be there that if you committed any crime or did anything against the law, I had to report it because
Yeah.
federal employees and active duty members are held to high standards. And
Standards.
that
Yeah.
actually had to change. And in my brain, I'm still kind of struggling with that a little bit that, oh, well, you can have an abusive relationship. Come tell me. And as long as you're two adults, I don't have to report that unless you're an
Yeah.
imminent risk to self or others. So
Others.
I
Yeah.
think it's important as I continue to reframe, and I've been out of the military for about 4 years now. This importance of the confidentiality that we do have, unless you're a minor. If you are a minor, we do have to report that as you're considered a vulnerable population, and in different states, depending on what age. I am licensed in 6 different states, but most older adults, 65 and above, are also vulnerable populations, so
Yeah.
we'll have to report that. But outside of that, you get to just be with your therapist, telling them what you're struggling with in your current relationship. And again, as long as there's not a safety concern or imminent risk to you or someone else, we get to keep it confidentiality and get to go through the process with you. And that is a very part of the process. I think a lot of people don't realize that. And I
That's
get
right.
asked questions. Sometimes it's like, well, if I were to tell you this, do you have to report it? I'm not saying it, but what if I were to tell you this? And we can play those scenarios, and I will encourage people watching to have those scenarios. You can have what if questions, or if someone else will to tell you this, will you have to report it if that's a concern to you? And we're constantly in that conversation of building trust
Yeah.
and building as role models of what secure attachment is, which is you can bring anything that you're comfortable or uncomfortable or saying or fear of reporting, and hopefully your therapist will be an example of that kind of back and forward relationship and keeping things very honest and very safe for you.
So important. And to emphasize that for survivors that might be watching this, that they don't have to report to the FBI to access treatment under pathways. And so we want to emphasize that portion of it, because I think there's some misconceptions that, oh, I can't access therapy under pathways unless I report, and that's just not true. So
It is not.
thank you,
Yes,
Dr.
thank you so much
Katie.
for having me.
Yeah, amazing. And I have not been looking at any of the comments, Crystal, so I don't know
I
if there's a
have. So I'm going to jump in. There hasn't been a lot of comments because this has been very much a presentation. I want to start by thanking both of you. And I'm going to try very hard not to cry. But that's going to be very hard for me because,
Mm.
Natalie, I want to thank you for what you're doing for so many survivors. You are making this possible. Steve Patton, everyone for funding
Yeah.
and honoring so many people. I want to honor Elizabeth, our survivor tonight that we've been discussing. I want to thank you, Dr. KP, for understanding how we think, how we make decisions, how we feel. It's so complex. You've mentioned it several times. We have so many wounds from that inner child all the way up through whatever trauma it is that we have gone through. But tonight, I feel my takeaway from tonight is hope and healing. It is that there are people that understand, there's funding available. We have a network that is standing by, ready to help you heal. And I want to thank you both for honoring that healing is possible. That is such knowledge is power, but so is therapy. I've been through so much therapy myself. There is so much stigma around it in this particular group.
Mm.
I want to honor the memories of people who are coming forward and losing that the dissonance in their 90s. However, whatever it takes to get to the point that they are acknowledging the suffering. The wounds that we carry are so deep and so, you said it, Dr. KP, about that in our culture, suffering is magnified, amplified. It's righteous.
Yes.
The greater we suffer. And it is such a painful existence. And so even for people who did not endure SA or CSA or domestic violence or all of the other types of abuses, there still is the wound of the suffering and the humility around that. You guys have talked about forgiveness tonight and how we have been taught to forgive and forget and that it's in the past. Thank you for honoring that that is not reality. That is not possible. The body does keep the score. It is impossible to move forward without, you cannot, for anybody out there listening tonight, I just want to say that flipping a switch and pretending it never happened, it's you're in a pressure cooker. It's going to come out some other way, some other time, some other horrific situation that you don't want it to. So you can't put a Band-Aid on a wound that's this big.
Correct.
Um, I want to honor the need for connection that you both talked about. That's what this group is about. That's what we're trying to do here with Survivor Rights, is to build community, build those connections, because we have lost so much of that from what we came from. but we are learning how unhealthy it was. We are learning how sadly unhealthy and how many horrible patterns of abuse we tolerated for so long. And
Mhm.
so I want to just thank both of you tonight. I appreciate the individualized treatment. I appreciate your perspective. I appreciate your commitment. There is so much information here tonight I'm gonna have to go back and watch it again, just to take it all in for myself, even though I've been through therapy for a long time. I'm seeing about 5 more shows at least with the two of you.
Right? Yes.
At
Yeah,
least
every
5
question
more
can be a
shows
show.
Yeah.
because, you used a lot of terms, there's a lot of knowledge in here, so this is what I wanna say to people that are watching this tonight or watching later. What I wanna say is you don't have to understand everything that was said tonight. You don't have to if all you can do is feel the love, feel the connection, feel the hope of therapy, the hope that can come with individualized treatment, the hope that can come with somebody who understands the complexity of it, that is highly educated, that genuinely cares. That is the level of commitment. Those are the priorities that we're bringing to the table here. It's why we're having these hard conversations. We are not trying to romanticize anything. What we are trying to do is help people understand that they are not alone anymore. You are not alone anymore. And Elizabeth, the courage that it took for you to come here tonight through Joanna, through your doctor that has helped you, I want to just, again, I can't say it enough to honor both of you so deeply. Um, the I could go on and on, but that's basically at the end of the day, we are all, some of us that have left 40, 50, 60. I can't.
Yes. Thank you. Yeah.
Mhm.
Thank you. Thanks for having both of us. And Dr. KP, thank you.
Thank you so much.
Appreciate the
I'm so
conversation.
honored and humbled to be in your presence, and such a rewarding experience to be part of the healing journey
Yeah.
for
Thank
everyone.
you. Yeah.
Yes.
Yeah. Mm. Mm. I think you touched on it, Crystal, that just to emphasize that healing is possible and you're never too late to the game. There's no such thing as too much to heal from, that it is possible. And so if you haven't yet started your healing journey, please reach out. It doesn't have to be through pathways. If you don't feel comfortable, go a different avenue. It doesn't matter. Just as long as you access healing. And that's my last word. Emphasize healing.
Yes, and with healing, through the attachment lens, we know that all we want to do is be seen, be loved, and be safe. And when your main attachment group and figure has been taken away, not only for the right reasons, but through such a difficult situation, then there's a sense of emptiness that leaves you. And through the healing process, you can find that from within. You can find what we call secure attachment. And then once you have it, like with tonight with Elizabeth, then you can gift it to other survivors through your healing journey. And so hopefully, if it's one person that was informed and touched today, I think we did, or at least I know I did what I came to do.
Yeah.
Thank you so much for having me. Okay. Thank you. Bye bye.